Today we're going to be talking to you all about the history and awareness of erotomania. By the end of this presentation, we want you to have a solid understanding of how the definitions, treatments, and cultural implications of erotomania changed over time. Speaking of, today, BMC psychiatry describes erotomania as a psychiatric syndrome characterized by the delusional belief that one is loved by another person of generally higher social status. As we continue, you will get a better idea of how this came to be the current acceptable definition.
In the classical period to the early 18th century, erotomania was classified as a general disease caused by unrequited love. At the time, they categorized these ailments as lovesickness, which brought about depressive symptoms. Lovesickness was commonly described in the case of men in relation to unreciprocated feelings of love with a woman. At the time, astrology strongly influenced beliefs in society. Dissatisfaction related to love was linked to the influence of star signs and its effects on being more prone to melancholia, lust, and madness. Love melancholy was thought to be caused by an excess of black bile in the body. According to humoral medicine, emotions associated with lovesickness were caused by an imbalance of humors. A lovesick man in the Middle Ages would be prescribed baths, sports, and even therapeutic intercourse as a way of distracting them from their thoughts, whereas the lovesick woman was prescribed marriage instead. Erotomania would later be characterized as a female-dominated illness category and was thought to be prevalent among women in lower classes with limited educational experience. This marks the difference from early documentation of the illness as seen in this period, where most cases were those of educated men with higher levels of influence in their respective societies.
Now for the 18th century. In the early 18th century, erotomania was described as excessive physical love and was as prevalent as ever. During this time, Dr. William Black conducted a statistical survey and found that love was the most common cause for admission to the Bedlam Hospital. Mad doctors such as Thomas Arnold, William Perfect, and Alexander Crichton recorded a number of cases where they attributed insanity to reproductive organs. For women, this meant it was the result of menstrual problems, menopause, puerperal fever, and childbirth. In terms of symptoms, some differed from men to women. Men would experience fainting fits, but women would experience the whites, which was basically a loss of color from their skin. In terms of treatment, the focus was no longer on medicinal regimes like it was in the Victorian times. In the early 18th century, the emphasis was now on sexual outlets as remedies. This era still saw sexual desires as powerful. Society at the time believed that sex on the brain came before actual sex, meaning sexuality was best stimulated by the brain and our imagination. Let's move on now to the 19th century to see how this continues to change.
Erotomania at the turn of the 20th century was first synonymous with the diagnosis of nymphomania. In 1920, erotomania would be taken on by French physician de Clerambault, moving away from Morel's degeneration theory. De Clerambault defines erotomania as when a person, the subject, believes that someone else, the object, is in love with them. According to de Clerambault, erotomania can appear in an individual in two ways. The first as a primary illness, and the second as an offset of another mental illness such as schizophrenia or bipolar disorder. Although de Clerambault believed that erotomania affected women more than men, the subject of his case study was the male Mr. X. Mr. X was convinced that 3 different women were in love with him but could not express it despite their protests over his lifetime. A violent interaction with the 3rd woman would lead to his confinement in a mental hospital where he would be treated with risperidone and diazepam. In the late 20th century, Buzz and Schmidt would go on to further de Clerambault's findings, tying erotomania to SST, or sexual strategies theory, which states that humans have behavioral strategies for solving reproductive problems. Erotomania is one strategy that is never effective, but some try.
Now let's move on to the present day.
In today's clinical setting, erotomania is characterized by the presence of a delusion in the patient that he or she is loved from afar by another person. Erotomania is rarely diagnosed in our modern society and rarely calls for medical intervention. This is unless the patient commits socially disruptive acts, such as stalking or harassment. While historically the label of erotomania was commonly used for women, those exhibiting socially disruptive acts today are most often men. Erotomania is now commonly placed under the umbrella term of delusional disorder, defined by a state of psychosis in which the sufferer cannot distinguish what is real and what is imagined. According to the DSM-4, there are 5 specific branches of delusional disorder. Overall, delusional disorder is still highly stigmatized in our modern society. With the emergence of modern medicine, there are also many more pharmacological approaches for treating erotomania and delusional disorder overall. One example is Pimozide, an antipsychotic drug that is also common in treating individuals with Tourette syndrome. One modern-day case study of erotomania is demonstrated within the patient Miss A. This individual was admitted by her husband after a series of delusions that a well-known natural healer was madly in love with her. Miss A exhibits various norms of a typical erotomania patient, such as having limited sexual experience and a history of abuse in her childhood. However, Miss A's case also demonstrates the promising prognosis of erotomania patients. Through a couple months of inpatient therapy and a concoction of drugs, including this antipsychotic medication risperidone, Miss A soon saw a reduction in her delusions and feelings of anxiety.
The respective viewpoints of each time period on femininity, love, and sex illustrate a shift from a hyperfixation on a woman's sexual activity to a focus on an individual and their imagined belief that someone loves them. This shift in diagnosis occurs with the Clarenbaugh study. Today, erotomania can be linked to other diagnoses pertaining to delusional disorders and is now believed to be treatable. Thanks for listening, and check out our sources for more information.